Welcome back to day two of CCP's 11th CEO Investor Forum. We just heard from Mark Schneider, the CEO of Nestle, sharing his sustainable long-term business plan. And now I'm delighted to introduce Tom Polen, the CEO and chairman and president of BD, or Becton Dickinson, as some recall, sharing his view on the integrated sustainable business plan, advancing the world of health from BD. Tom, great to see you today.
Great to see you as well, Daryl.
Great. Tom, I'll turn it over to you, let you share your sustainable business plan, and then we'll kind of come back with some questions. Members of the audience, feel free to send those on. You guys have the directions on that. And love to have this dialogue about how you all are creating sustainable value. Tom.
Great. Well, again, thank you for the opportunity to have the discussion. I know we've been chatting for a while about being able to make the time to do this. We're really pleased to have a dialogue here today. So I'm just going to make a quick disclaimer. Obviously, I'm going to could be making some forward-looking statements and encourage you to read the disclaimer in today's slides and disclosures in our SEC filing, which are available on our IR website. So, for BD, we've been advancing the world of health for more than 125 years. And our purpose is what drives us forward towards a lofty but common goal. It's the engine of the company, it's the source of our energy, and it's the catalyst that we see for us doing good, right? It is literally to advance the world of healthcare. And that notion of advancing is something that we challenge all 70,000+ of our associates with, right? We want to be out in front, leading, innovating, shaping the future of health and the role that it plays in advancing society. And literally everything we do goes back to our purpose. It's core, it's what guides us in our decision-making across innovation. If you're not familiar with BD, we're a global medical technology company with operations in diagnostics, in core medical devices, and in interventional devices used in surgery or procedures. We're often referred to as the backbone of the global healthcare system, with more than 37 billion devices that we make and provide to patients each year, literally touching the lives of billions of people around the world in more than 190 countries that we serve. If you look at just the US alone, our products touch more than 90% of every patient who walks through the doors of a hospital. And pretty certain that anyone watching this would have been touched and impacted and benefited by our products, whether or not you brought your child to a pediatrician for a standard blood draw, you've gone to the hospital for surgery, you've had a flu vaccine or a COVID vaccine or a COVID test, or you're living with a chronic disease in later stages of life. Our portfolio touches and helps people get well in those times. Our products include both core healthcare products like catheters, IV sets, infusion pumps, syringes, hernia mesh, products used to draw blood, but also advanced transformative solutions that harness the power of AI, robotics, and automation that help enable care to shift to new settings and that help improve outcomes for patients with chronic disease. And so inside of BD, you would find a $700 million pharmacy robotics business, as an example. Robotics that transform the microbiology lab and automate that testing, be able to get results out faster with fewer staff. Technologies like smart connected medication management in the hospitals, helping to use software to safely compound drugs in the pharmacy, move those up to the nursing floor and manage those in an effective and safe way, and then make sure that they're infused to the patient throughout our devices, again, in a safe, effective way. Our strategy is referred to as BD 2025. It's our roadmap for value creation, and we think about it in three key pillars: grow, simplify, and empower. And when we think about our growth strategy, we've committed to 5.5%+ top line growth, driven through focus on innovation in the areas that I described. We've been very purposely moving our portfolio into higher growth spaces through both organic and inorganic actions we've been taking. Second pillar is on simplifying. We strongly believe that complexity is bad. It makes it difficult for customers to do business with you. It makes it difficult for your associates to get work done, and it costs money. It could be diverted back to innovation and growth, which for us means helping more patients. And so we've got a strategy to simplify our manufacturing network, our product portfolio, our business processes, and we're making great progress on that. And that contributes to us delivering on our commitment to grow EPS 10%+. And then our final pillar is empower. And that's core to our culture and who we are. Our cultural elements are described to associates through the BD way, which is how we do things, how we operate with a growth mindset, how we operate with a servant leadership approach to leadership. And that's been core. We also consider how we empower the organization and we empower our technologies digitally and the investments we're making under that pillar. Addressing ESG issues is woven across all three pillars of our strategy. And so if we take another click deeper into our ESG strategy, we refer to that as our Together We Advance strategy. And we established that in 2021. And it addresses the most relevant ESG issues for our organization and our stakeholders. And we focus on enhancing the stewardship of the company, the communities that we participate in, of human health, and of the planet. And it really, our strategy embraces the connections and interdependencies between these pillars. And when we successfully address the health of one area, we often solve for challenges in the other and ultimately drive a positive collective outcome across all four pillars. And within those kind of 5 key areas that we're focused on making the most impact over the next 5 years are climate change, reducing product impact of disposable medical devices, ensuring a responsible supply chain as we're making billions of devices a year, ensuring a healthy workforce across our 70,000 associates, and healthy communities in which they live and operate, and transparency is the 5th. And so we've made commitments and established a set of goals for 2030 and beyond that allow us to track and measure the success of meeting our commitments. These goals also continue our commitment of advancing achievement of the UN Sustainable Development Goals. And so as we think about those SDGs or Sustainable Development Goals, we really view those as providing a framework for us to understand our material issues with the greatest sustainability context and with reference to broader sustainable development conditions and goals. And so as a healthcare company, as you can imagine, we align most prominently with SDG 3, which, while there's others, that's the one that mostly focuses on promoting healthy lives, well-being for all. And to support achievement of SDG 3, good health and well-being, we're tackling infectious disease challenges through the use of technologies used to diagnose and manage infectious disease. And we're also positively impacting chronic disease management, which of course today is the leading global health priority. And we do that through our technologies and innovations and our very strong manufacturing capabilities that allow us to scale and deliver technologies at very, very low costs. We have billions of devices, for example, that we sell for a dime or a quarter. Our longstanding work to protect the safety of healthcare workers through products and partnerships promotes good health and well-being as well. And we do that through partnerships that strengthen the capacity of health systems in both developing economies and developed. And obviously, we have a big focus at BD as well on reducing hospital-associated infections, as well as addressing non-communicable diseases, which I'll talk about later with an example of how we're improving healthcare equity in cervical cancer detection. The other SDG goal that we're focused on is SDG 5, which is gender equality. And we believe, as I think many companies do and should, is that in accordance with our code of conduct, everyone deserves to work in a supportive, inclusive, and safe environment. We provide equal opportunity for all of our associates, ensuring that we safeguard against discrimination on the basis of protected characteristics, including gender. And this extends to our suppliers. We're really proud of the work that we've done over the last few years. Just this past year, as an example, we significantly increased the opportunities open to small and diverse businesses. We achieved a 75% increase year over year in the number of certified small and diverse suppliers within our company's supply chain. And in this time, we've spent more than $600 million with these suppliers, totaling $1.1 billion in positive economic impact. We've also conducted, for well over a decade, annual pay assessments across our organization. The specific goal to make sure that our global associates, and particularly gender, that both men and women are paid equitably. And every year, particularly as we acquire companies who may not have those processes in place, we'll make sure that we have equity across the organization and we make adjustments every year. Again, and we typically see that as we've been very active. We've done 19 acquisitions over the last 3 years. Many smaller companies don't have those practices in place, and we see movement pretty much every time that we do those and are able to help ensure that there's equity in the part of BD. We also partner with NGOs to make investments in a number of areas, and this has been a long-standing practice of the company. That includes both women-focused health programs, where we have a lot of relevance to make an impact. It includes advancing mental health, reducing avoidable newborn deaths, and expanding access to women health services in U.S. free clinics and community health centers that I'll talk about in a moment. When it comes to SDG 9, industry, innovation, and infrastructure, our work's grounded in an intentional strategy aimed at advancing equity and access. And this is achieved through our technology and innovation, our public-private partnerships that we have long-standing track records in around the world, whether or not it's in the US or China or Africa or Europe. We have a long track record of working with governments around the world to advance healthcare and make investments to advance local health systems. And I'll talk about that further in just a bit. Finally, aligned with SDG 13, climate action, we're committed to reducing emissions, and we've joined the UN Race for Zero via the business ambition for 1.5 degree Celsius reduction or goal, and science-based targets initiatives. We set science-based targets, which are currently being validated by SBTi, and have set a 2030 goal to use our capabilities to contribute to solutions that address unmet climate-related health needs. And so if you look back, as I said before, we have a very long history of playing a role in addressing health inequities around the world and access to health care. Again, you should think about we have advanced devices that sell for millions of dollars a year in advanced robotics running microbiology labs. We have billions of devices that we provide for a dime or a quarter that truly help healthcare be improved in all corners of the world. And that's been an important part of who we are, and it's been part of helping us be ingrained in the communities that we operate in. Again, it's more than 100 around the world. And so we'll talk about these in a bit later on, but some of the products and solutions that we invest in directly address these healthcare inequities, such as self-sampling for HPV screening, which, as many folks know, cervical cancer is exclusively caused by an HPV infection. And by detecting that early, you can dramatically improve outcomes for patients that prevent cervical cancer in the future. And so we'll talk about what we're doing there to help enable that to be done in underserved communities around the world. It is reported, as you just step back and look at health inequities, it's reported that at least half of the world's population cannot obtain essential health services, with particularly wide gaps in the availability of services in sub-Saharan Africa and Southern Asia. WHO estimates that 22 countries need to rebuild the very foundations that their healthcare systems are built upon, from equipment and medicines to human resources and governance. And close to 1 billion people in low and lower middle income countries are served by healthcare facilities that don't have reliable electricity or no electricity at all. Certainly, as we look at the need for primary healthcare, it's a priority across low and middle income countries, as this function plays a central role in the delivery of care for patients. But these programs often lack sufficient data that target and address the real healthcare weaknesses that are facing underserved populations. And so we've been meeting healthcare systems where they are today. It's been a longstanding commitment of the company to help maximize today what they can do to provide quality patient care and how they advance that over time. We look to enable an environment for access by leveraging our capabilities and our expertise, often through public-private partnerships. Our track record says very difficult for any one organization to do this alone. It works best when it's public and private organizations working together to scale and strengthen. We leverage our global reach of our products, our research, and our solutions to help make those impacts. And our investments in healthcare strengthening. A good example is our Labs for Life program, where we would bring in containers, literally tractor trailers with mini labs in them, and deploy those in underserved communities throughout Africa. We bring in our experts. We have, for example, 800 nurses that work for BD. We have hundreds of laboratory professionals, and we take our experts into those communities, paid time off from their normal work, wherever they're living. And they go into those communities and they use the asset that we've deployed, and they train, certify, strengthen the local healthcare system. Those are practices we've been doing for decades. We continue to do those today. And it's something, again, that we're very, very committed to as part of strengthening the underlying health systems that serve patients around the world. Just to share another deeper example as we look at health equity and the importance of that. So whether or not you step back, when the polio vaccine came out, we actually partnered with Jonas Salk to design a very customized syringe that was required to deliver that vaccine effectively. And we ended up scaling that syringe to vaccinate the world and help eradicate polio. That was really one of the first big scale initiatives that BD drove. Since then, we've expanded technologies that have enabled HIV monitoring to reduce the burden of HIV around the world. We're one of the world leaders in TB testing, helping diagnose TB and determine what drugs to appropriately treat, and with the aim to eradicate that over time. Most recently, during the pandemic, we were one of the first 2 companies in the world to develop a rapid COVID test and ended up delivering millions, tens of millions of those tests around the world. We also scaled our vaccination manufacturing to deliver 2 billion COVID vaccine doses to help combat the COVID-19 pandemic around the world. We've partnered in both developed and under-resourced countries to expand access and build the capacity of health systems that serve patients around the world. Just a few further examples in the US, one of our biggest investments that we make is to partner with the community health centers and free clinics that serve really as a healthcare safety net for millions of Americans, particularly in areas of high health disparities. We've donated more than $24 million just to that specific program alone. Expanding capacity for antimicrobial resistance is a big focus of ours. As you can imagine, that antibiotics are often used in the care of animals, which gets into the human body then and increases drug resistance. You see widespread abuse of antibiotics, again, increasing antimicrobial resistance, which becomes extremely critical issue as you think about people having organisms that just can't be treated with many widely available antibiotics. And so helping to be able to minimize widespread use of antibiotics, help make sure that proper diagnostics are available in those. We've been focused in 16 low and middle income countries in partnership with the Fleming Fund to advance that capability and reduce the burden of AMR. We've been focused on strengthening TB resistance and testing and building diagnostic capabilities in Asia. We've invested in developing national nursing associations in Africa, again, helping to train nurses as well through deploying just a portion of our hundreds of nurses who have been trained and certified to help do the same for others. We recently announced an expansion of a decade-long partnership with Pfizer and the Gates Foundation and the Children's Investment Fund to help deliver more than 320 million doses of Pfizer's injectable contraceptive, Cyanopress, which is administered by our Uniject auto-disable prefillable injection system. We're going to continue to do that through 2030 as our commitment. That's going to help millions of women in low and middle income countries access injectable contraceptives in 23 additional countries and have had access to that historically. One of the things that's also core to who we are is we have an annual service trip that we do where BD associates from around the world will apply who bring specific capabilities that can help communities. We've traveled to Eswatini, North Macedonia, and Kosovo in just the last few years. And our team spend a few weeks there helping to improve health equity, help train local systems, and improve access in some of the most disadvantaged communities in the world. Those associates come back with life-changing experience and stories that they share with others across the organization. Again, it's part of our culture and who we are and helps us really connect as an organization to our purpose of advancing the world of health. Another area that we're very focused on is improving outcomes and reducing mortality from cervical cancer. Even though we have the tools to prevent and detect it early, it's still a leading cause of death and it is widely avoidable. Right? The WHO has rallied governments and partners to eliminate cervical cancer as a public health concern, and we're leading on this work around the world. We are one of the leaders in detecting HPV infections, which are the cause of cervical cancer. And our portfolio helps governments wherever they are in their cervical cancer screening journey, whether or not they need a high throughput platform like our BD Core or a more targeted smaller scale platform like our Viper platform. Our OnClarity assay enables very specific personalized risk stratification There's different strains of HPV, some that have low risk of developing cervical cancer, others that have very high risk of developing cervical cancer. And when we developed that assay, actually the only organization that has a primary screening assay that includes detection of certain genotypes that will report individual genotypes out that are found in specific minority populations. And so you'll find different prevalences of different genotypes in different ethnic populations. And it's important that we include all those genotypes in our assay, which we were very purposeful in doing, so that the assay itself helps detect HPV and helps optimize cervical cancer outcomes in people of all backgrounds. The other thing that we're leading in cervical cancer screening is self-sampling. Today, you can collect a dry swab at home in many parts of the world and mail order that in for cervical cancer screening. That allows a much greater risk, as many communities have hesitation or lack of access to go into a clinic to do that screening. We're in practice with that already in parts of Europe and Asia, and we're working on bringing that capability to the US. Our public-private partnerships focus across sectors to support solutions, and right now, we're advancing those in new countries like Kenya, Colombia, and India. And we're joining hands across the industry as well. For example, we're a founding member along with MSD in the Global HPV Consortium. We're also members of the American Cancer Society Cervical Cancer Roundtable. Finally, just in closing of my prepared remarks, as a 125-year-old company, we have a long history of advancing the healthcare industry and of ensuring that people around the world can access basic healthcare to live healthier lives. Our more than 70,000 associates around the world are delivering on our purpose of advancing the world of health. And as an organization, we're continuing to progress in health equity and diversity, as well as reducing greenhouse gas emissions across our entire value chain through engagement with suppliers and our customers. We're evaluating our products and reducing energy demand in our operations and ensuring we're transparent and trustworthy among our stakeholders. We're proud of the work that we've played throughout history in advancing equitable health, and there's still a lot of work to do. But making meaningful, innovative medical technology won't matter if people who need it most don't have access to it. And so, Daryl, I really appreciate the opportunity.
That was terrific.
Yeah.
Thanks for really, and one of the beauties of these sustainable long-term plans is how, clear, concise, comprehensive, I think, in this, and integrated the plans are. So really appreciate you pulling that together, from a BD standpoint, the great track record the company has had and the impact it continues to make. We have a number of questions that have come in, which we'll share from our audience and others. First, one has come in, these will come from various interests, but any plan to move towards science-based targets as part of your net zero plan?
Absolutely, yes. So we've actually already submitted science-based targets, anticipate verification very shortly for those. So in process. Very good.
Very good. Also, any governance improvements that you are planned or making from a BD perspective?
Yeah, so we have our, from a board perspective in particular, we spent a lot of time thinking through our ESG goals, how are they reviewed from a governance perspective. So step back a few years ago, we actually established a new committee on our board, which is our QRC, our Quality and Regulatory Committee, which oversees to ensure, of course, as we're bringing new innovations to market, ensuring that they're at the right quality with the right compliance is essential. So that's a committee that we thought was extremely important in that. In terms of overseeing our work that we're doing from a sustainability perspective, our inclusion and diversity goals as well, that all goes through our CGM committee. And we have essentially every time where we're touching base on that. We also created a dedicated meeting every summer, every June. We have just one board meeting. It's a teleconference that's just dedicated to ESG, because we find, of course, it's hard to find the time to cover all the topics you want, and to really just mentally kind of stop thinking about numbers and the shorter term opportunities or exciting innovations, and just sit down with the board and talk about how we're progressing on our ESG goals and reflect on that. And so we decided the best way to do that was to add in a dedicated board call, a virtual call every June, 100% dedicated to that topic. And that's worked out really well. We've been doing that for about 3 years.
Okay, no, that's great. Now, there has been some pushback on ESG of late. We actually started off today's session with a debate from someone from the right and someone from the left kind of talking about it. And it was a constructive conversation, not screaming and yelling. I think they got to some good points in that. How do you view the pushback, and how does that influence how you're thinking about ESG type efforts at BD?
Yeah. Yeah, we can't even comprehend that there's any downside to that. It's not something in our DNA because we've been doing it for 125 years, right? It's truly, we kind of, when we saw kind of the momentum in the space, we look at it and say that's exactly what we've been doing for 125 years. It's who we are. And I think we've lived it for that entire time. So, but for us, helping improve healthy communities, that's what we do. Reducing the burden of, we do make billions of devices a year. Right? We want to look at it as modern as technology is advancing. We hunt for how can we help, how can we recycle those? We just completed an amazing pilot in the US where we had deployed tech, we had created with a recycling firm many years ago an approach to recycle materials within our plants, right? So where we had taken plastics, combined them with, for example, needles, and we end up scrapping them for some reason during the manufacturing process. We want to be able to separate out those materials, regrind, and put them back in to help improve operations, now allow us to lower costs, continue to ensure the cost effectiveness of our devices. And we've been using that technology that we had developed for many, many years. Kind of one day, just a year ago, we said, can we do that for medical waste in hospitals and apply that same technology that's been developed? And so we went and we piloted it this past year with 40,000 pounds of medical waste, used syringes, used blood collection tubes. And we're extremely successful in doing that. Actually, that resin we were able to separate out those materials, turn that back into resins that could be used in the manufacturing process and at lower costs than buying resins that were virgin resins from scratch. And so that's something that we're really excited about. We'll continue to scale that as we think about wanting to lead the way in 360 life cycles for medical devices.
You know, in a world where some seem to think ESG stands for every single gauge or metric, we sort of see that in some parts of the world, and others think about ESG as being evil socialist government. Is there's kind of an answer here that's just sort of smart business, and I like the way that you've talked about it in real specific terms. I mean, it's about better equity in healthcare. It's about specific things that companies are doing. It's going to vary by industry and company, but kind of interesting.
We often get asked the question, does it increase costs? We see the work that we're doing, we see a long runway of opportunities that are actually driving efficiencies, right? Using less power is more efficient. Doing what I just said around preventing medical waste. The reality is hospitals spend billions of dollars to dispose of medical waste today. If you could turn that investment into, rather than billions on disposing of, but redeploy that money into recycling, that's a good outcome for everyone involved. And so we see just win-win opportunities across the board. We don't see kind of a win-lose scenarios. Those aren't the scenarios that we would ever focus on.
No, that's great. And I think more and more companies, particularly innovative ones, are saying these are just opportunities for us: reduce waste, cleaner air, cleaner water. When we think about S equaling the stakeholders you're serving, I think it all helps us on that process. Questions come in on, talks quite a bit about health equity and your efforts in the US and around the globe. And a lot of that on a global basis is really about addressing costs. How can you get to lower cost pieces? You mentioned your 30 plus billion devices that are out there. How do you make it cost effective in emerging economies to provide the products that you all develop and produce?
Yeah. Hey, so we are at our core an innovation company. We're a manufacturing company, and we're really good at producing low cost devices. And when you think about the cost of a syringe, it's been basically a dime for 40 years. So that's pretty good. Not many products you can say kind of have been in that price point for 40 years. And that's because just every year we're ruthless on continuing to drive efficiencies in our organization. If you come into our plants, whether or not we manufacture in the US or in Asia, there's not a big cost difference for us because there's so much automation in our factories. Again, you can't produce 10 billion units in a factory by hand. This happens with high levels of automation, very high speed automation. And that's been the core to our success. If you were coming to our culture, you'd find Kaizen and continuous improvement to be deeply ingrained in who we are. And we're very responsible in terms of from pricing perspective, et cetera. We think through the availability and the access of our products is essential to who we are. Again, our products are used in the majority of medical procedures around the world, and they need to be affordable to patients, affordable to providers, and we take that ownership on ourselves to do that.
Lots of talk about AI and artificial intelligence, machine learning, and the rest. How are you applying that, and your thoughts on that from BD's perspective?
Sure. A couple of ways. One is we certainly apply it to see how we can be more efficient as an organization. So we're doing, we've got active pilots on the next gen ChatGPT we have access to, and other AI solutions, looking at how we can, for example, new regulatory requirements in Europe that require surveillance of literature and reports on each of your products to determine if is there any safety signal that's being seen. How can AI help us do that surveillance rather than having physicians, et cetera, do that, write up the reports? It would be an example of how we're exploring using AI to do that. We're doing active pilots in it today. Other areas is we're applying AI right at our customer sites. And so we actually have several FDA cleared products that use AI. And a good example of that would be in the microbiology laboratory, where it's very hard to find trained microbiologists today. It's an issue around the world. Our robotic systems allow you to basically have virtual microbiologists where robots are streaking Petri dishes. There's smart incubators that are taking pictures, and AI is actually reading them and interpreting. This is a superbug. This is an MRSA bug, as an example. That can now be determined via AI, or this patient is negative. We can go ahead and release those results rather than waiting for a person to do that. That's a good example. We also use AI right now, for example, to help identify clinicians in a hospital that could be utilizing narcotics. One of the unfortunate situations is around the world, healthcare providers, just given access to narcotics, have much higher abuse rates. And so because we have so many smart devices in the pharmacy and on the floors, our devices can see how people are interacting with them. And there's certain behaviors that people who are maybe diverting narcotics engage with our devices on. And so we partnered with Microsoft several years ago and developed an AI algorithm to help hospitals identify those providers so that they can get them help make sure that there's no harm to patients as a result of that. And that's been a huge success for us as it does things that you just can't do without AI. So there's just a few examples how we've been applying it.
Good. You also talked, you have your own nurses at BD. We talked last year with various companies at Advanced Advamed around the kind of nursing shortage. Any programs that you have to help offset that, I guess, via technology or innovation?
Yeah, quite a few. I was just early this week spending some time with some chief nursing officers talking about that. So yes, we actually have a whole new set of training capabilities we're developing using virtual reality glasses to enable nurses, and particularly in lower income communities. We can bring those in and do virtual procedures, and then end up kind of ranking on basic capabilities, moderate capabilities, or advanced capabilities, and help people understand which of their nurses are at what level of procedural effectiveness. And then again, take additional classes virtually to do that. In parts of Latin America, I was there last year. We have these ATMs that BD has built that are really put in the hallways of hospitals or in the break rooms for nurses, that the nurses can go up, and it's gamified training for nurses on best practices for infection prevention or catheter insertion. And they just have to take a little bit of extra time, but it goes to where they are and they can do it in their spare time because it's such a busy environment. We also spend quite a bit of time creating new innovations that improve the workflow efficiency of nurses. So as an example, on infusion pumps, not needing to program the pumps, but being able to just scan the patient armband, scan the bag of medication, and the electronic medical record auto programs the pump, reduces errors, saves significant time. You can see that save millions of nursing keystrokes a year through that type of technology, which is a big satisfier for nurses. So they can focus on the patient, not entering data or not programming, not concerned there's going to be an error.
Time I spent on that. Yeah, just final questions here. You are a long cycle business, 125 plus years, but it's a short cycle world. Yesterday, a question just came in that you took a little bit of a hit on the share price.
Yes.
Is that something that you concerned and worried about, or is just that's just sort of the blip that goes on?
Yeah, that was really an FX topic. So we continue to get a great year last year, well ahead of our 5.5 top line, right, 10% bottom line commitments. The past guide that we just shared was very much in line. Right? We gave a midpoint of a 24 guide right at the start of 575, so above our commitment there, and 10% organic, 9.25 when you include the divestiture that we did, so right in line with what we had shared. That was on an FXM basis. But there were some big swings in the peso and other currencies in the last 30 days, the last 60 days before we had given guidance. And so on an FX basis, we saw that hit. We're continuing to do work to overcome FX from that perspective, but that was the driver.
Okay. No, thanks very much. Last question, innovation. Spend $1 billion a year plus in R&D. Sounds like you even have some innovation people together in Franklin Lakes today. Your kind of thoughts on that and outlook for continued innovation. You've had so much over the years. Can you keep it going?
Yeah, we've never been more excited about the pipeline that we have at BD. We often say we have the most exciting pipeline in the company's 125-year history, and that's absolutely the case that we believe it. As you mentioned today, as I walked in, we had literally busloads of folks from our innovation centers around the world. We have our Howell Awards. We celebrate the scientists are making the most impactful new innovations come to market for our patients and customers, and so that celebration happens to be today. As you said, we spend about 6% of sales in R&D, which is over $1 billion a year. The majority of that has been shifted into these three spaces that I described earlier that we see as transforming the future of healthcare. And so the majority of our innovation dollars, over 60%, are going into new technologies for utilizing AI and robotics to improve, and software to improve general healthcare efficiency. The second area is new technologies like point of care diagnostics or point of care blood collection, as an example, or urinary incontinence management at home. Technologies that enable care to move from hospitals to lower complexity environments. Those technologies also play really well in markets that don't have that acute care infrastructure. And the last area is we continue to invest heavily in new technologies that improve outcomes for patients with chronic disease. Chronic disease management has to date largely been take medications or injections for the rest of your life. And there's really exciting new technology when it comes to medical devices, where medical devices can play a broader role in addressing chronic disease, which is, of course, the biggest burden from a financial perspective on societies around the world today. And so those are the three big areas that we're focusing our investments in, and we're really excited about what we've been doing.
Tom, this is terrific. Thank you for your leadership at BD, for advancing the world of healthcare, and for participating in this session. I think it's important in a world that is so many short-term things we have going on, that it's those investments in R&D that focus on sustainable value creation on your customers and all that make all the difference. So thanks very much.
Thank you, Darren. Thank you for what your organization does. This is great.
Yeah, really greatly appreciate it. So thanks, Tom. And we'll be back with CEO of Exelon, Calvin Butler, in a few minutes. So for everybody there, thanks. And thanks, Tom, to you and the team at BD. Cheers.
Thank you, Darren.